It has been my vision since I was a young nurse to support healthier workplaces. Have you heard 100 times how high the cost of healthcare is? Why is it so high? I think it's because people are overusing it, maybe not using the right kind of it. So my vision is to support employers and having better healthcare options for their employees because it saves them money. Well, that's their objective. Mine is more health, but there are three issues I want to cover here. And one is having shared values. Shared values, informed consent, and honoring the individual. The shared value is we all want to see people healthier, be more productive at work, have less absenteeism, be more supportive of colleagues. And the employer is satisfied when that happens, when people are present and they're healthy and they can function. For me, when people are present and working well, they're not sick. They're not taking care of dependents. Do you know how many women lose work time, their valuable sick pay, for children who are eating foods that are counterproductive to the children, that are being pushed on them and recommended by their providers? And it's kind of a maelstrom of sorts. So the employer loses the employees' work hours, the employees losing their own sick time, the child's not getting any better. And my vision is to be that person who helps bring people together, to help look objectively at the system. The second piece here is informed consent. When you get a medication that comes in a box and this insert is invisible or blank, does that tell you how some of the informed consent is happening? Yes, it does. Because there's not informed consent for a lot of things. We have a lot of propaganda, conditioning. You should do this, you should do that. And a lot of it's money driven. And this is free on your healthcare plan. Free. Wow. Well, there's no free lunch. We all know that. So informed consent really is allowing people to know what the risks are, know what the value is, be able to make a decision. And who better to help support an employer with that than someone who's not vested? Have you heard the expression metrics, or also known as quotas? Would you be surprised to know that it may be your healthcare provider that has a metric? And the metric says if you come in for procedure A or X, they get a better bonus at the end of the year. You're a provider. They would never do that to you, right? That they do it for somebody else, but not you. Except that they do it to you because you're part of their plan and they're employees. So informed consent for why you should need this particular procedure may have more to do with that person getting a bonus because they get a certain percentage of their patients to comply with a particular mandate. And you say, this sounds conspiratorial. Well, it may be. Then it's the reality. Metrics, quotas. Is that truly informed consent? You know, I took my husband for a procedure. I took him in to see his doctor. The doctor said, I'd like to see your husband. And I thought, okay, this is a good follow-up for a procedure he had. And here I am. I'm a nurse. I've been a nurse my whole life. I have academic degrees. I wrote a book. I know something about the system. And I went in and very naively thought they were going to talk about my husband's procedure and how he was doing. And in terms of informed consent, the doctor proposed this vaccine, that vaccine, this vaccine. And I thought, what does this have to do with this recent care that he had? Oh, nothing. But I think it had to do with metrics. And we were out of there shortly. It's the reality of it. There's a certain tilt in healthcare in terms of profit. And I have no problem with profit. But I want to save money if it's going to cost someone more than what they should be putting in terms of their vitality. The third has to do with respecting the individual. We all should be able to have the health freedom to make the choices we want to make. You want this, you want that. It's up to you. You take care of yourself, you take care of your family. I have a colleague who was going to go for an injection in his back. And his doctor said, you should come on in, we'll give her your pain. And I said, what's going to happen? You're going to get the injections, the pain's going to come back. What's going to be different? Perhaps you want to go see X, and I made a referral to him. He went to see that person the very next day, canceled the procedure, changed his diet, transformed his life because he found someone who would listen to him and help him be on the path that he wanted to be on. So in terms of saving money, I know about saving money in healthcare. In fact, I learned it when I wrote my book on breast wellness. Cherish the Girls, a well-rounded approach to breast health and wellness. And one of the most common things women would say to me, who's going to pay for it? Who's going to pay for this alternative exam that could save my life, reduce radiation, reduce compression? Who's going to pay for it? Who's going to pay for your funeral is what I said to some women. We laughed. The truth is, we all make choices, and we should be able to have informed consent, be able to know that it's our vitality that we're putting into it, and that we should have our own decisions respected. I don't mind what people choose for healthcare. I'm glad that they're making choices. I don't like bullying. I don't like pressure that's coming from a monetary position of exploitation, but I do like freedom. And I found that my vision for having better health and wellness in the workplace is a wonderful way to approach this is by looking at shared values, looking at informed consent, looking at respecting the individual. The employer is happy. I can be happy because I'm helping fulfill my mission of supporting people and having healthier, happier lives. And I'm grateful to have Toastmasters to be able to help share this. Thank you.